Hello everyone, welcome to Dentospedia, which is the most trusted platform for cracking dental board exam. So today I'm going to teach you a short topic on fungal infections of the oral cavity from the module of oral pathology. So let's begin with the topic. Fungal infection of the oral cavity are most commonly caused by Candida albicans. Understand, it is an opportunistic yeast that normally lives in the mouth but causes disease when immunity is lowered. So first is Candidiasis, which is caused by Candida albicans, which is an opportunistic yeast infection. So see, Candida become pathogenic in immunocompromised patient. Understood? In immunocompromised patient, in long-term steroid or antibiotic use, in denture wearers, in poor oral hygiene condition, or in nutritional deficiencies. Understood? So see, types of oral candidiasis. So first is pseudomembranous candidiasis or oral thrush. So first is pseudomembranous or thrush. So see, there will be white removable plaques on the tongue and palate. Now seen in immunocompromised patients like HIV, chemotherapy or corticosteroids. The patient is having HIV or patient is under chemotherapy or corticosteroids. Understand? Now there will be white creamy plaque seen on the tongue, palate or buccal mucosa. Now plaques are usually scrapable but leave a red raw surface. Understand? It leaves a red raw surface in infants, elderly, or immunocompromised patients. Understood? Now, candidiasis is the most common oral fungal infection, often in immunocompromised individuals. Understood? Now, next type is erythematous candidiasis, also called as atrophic candidiasis. So, see, there will be painful red patches on the tongue and palate. Now, often seen in denture wearers, called as denture stomatitis. So, there will be red painful patches commonly seen on tongue or palate, now oftenly seen under denture wearers, called as denture stomatitis. Understood? Now third type is hyperplastic candidiasis. Hyperplastic candidiasis. So see, there will be white plaques that cannot be scraped off. Now it is firm and persistent and needs biopsy. Understood? It can mimic leukoplakia. Now next is angular cheilitis. So see, it is cracked red corners of the mouth and is associated with nutritional deficiencies, iron or vitamin B. Understood? So what will happen? There will be cracked red painful corners of the mouth. Understood? Usually seen on the corner of the mouth. Now it is often blistered as it is associated with candida infection or nutritional deficiency like iron deficiency or vitamin B complex deficiency. Now there will be reduced vertical dimension or ill-fitting dentures. Understood? It occurs mostly due to ill-fitted dentures. Now see, candidiasis is the most common oral fungal infection. Now what will be the diagnosis? What will be the diagnosis? So you can see KOH test or PAS stain can be done. Understood? KOH preparation showing fungal hyphae. Now PAS stain or clinical appearance is often sufficient. Now treatment. So topical antifungals can be given like nystatin or clotrimazole or systemic fluconazole. Understood? Topical antifungals like nystatin or clotrimazole or systemic antifungals like fluconazole for severe or resistant cases. Understood? Now see, oral candidiasis is an opportunistic fungal infection caused by Candida albicans presenting as white, red lesion depending on the type. So you can see pseudomembranous, which is wipeable or which is scrapable. You can see it over the tongue. Then it is a erythematous or atrophic candidiasis. It is reddish in color. Then hyperplastic, which mimics leukoplakia. It is not scrapable. It does not scrape. And this is angular cheilitis seen in the corner of the mouth. Understand? All for fungal infections of the oral cavity. For more detailed video, please download our app Dentospedia and please do like, share and subscribe our channel. Thank you very much.